On the Health Watch, as the weather gets warmer, many people just assume flu season melts away.
But as Fox 61's Tim Lammers reports, that's not true, especially this year.
These are the yearly stats on flu hospitalizations, and they are nationwide numbers, but the basic trends hold in Connecticut. This blue line is last year's really bad flu season. Notice, though, that by this point in the season, it had really tailed off, compared to this year in red. Never was as bad, but it's still persisting.
Last year's flu season was fairly severe. H3N2 was the predominant virus that was circulating.
And that was a big factor in why last season was so bad. Pulmonologist Dr. Stephen Caminiti said H3N2 is notoriously difficult to make a vaccine against. Plus,
H3N2 is particularly nasty. That's an influenza A virus. That's the one where people wind up in hospital and wind up dying.
Not all flu strains are the same. This year, H1N1 has been the most prevalent strain overall, but that's been changing in the past few weeks. Dr. Ulysses Wu of St. Francis Hospital said that's not uncommon.
What will happen is that there's a predominant flu strain that usually occurs early on. And then as that flu strain fades out, then other flu strains start coming in.
Lately, the percentage of cases involving H3N2 has been climbing.
H1N1, that was the predominant strain early on in the season. And now we're starting to see a little bit of this H3N2.
H3N2 was typically the cause of more severe influenza. So the cold and flu season is not over. And in Connecticut, it can go into early May.
But reports of both strains should start to fade soon. They're both considered to be what's called influenza A strains. And Dr. Wu said those A strains start to get overtaken around this time each year, right as the total number of cases declines as well.
So we'll start seeing more influenza Bs, which are considered more mild, but also still dangerous at the same time. And once we get into April, then it's mostly Bs.
The FDA said this season's flu shot covers H1N1, H3N2, and then depending on which type of shot you got, it also covers either one or two of the B strains of the virus. I'm Tim Lammers. We'll see you tomorrow morning when we're all local, all morning for the Fox 61 Morning News.